All right, so interesting one: artificial intelligence and medicine. There was a question: who is more intelligent, human beings or AI? I guess the answer is obvious. Of course, human beings are more intelligent. Why would you ask such a question? The creator is more intelligent than what he has created. That's the simple answer. However, in everyday life, can be more intelligent than you, especially if you put it to very good use. I'll give you a very good example of how I describe AI in medicine and, of course, in academics. Growing up, didn't you ever think that, I mean, instead of reading all these big books, especially for those of us that studied courses that required reading huge volumes, you just think, wow, is it not possible for me to just grind this textbook and pour everything in my brain, let everything just be in my brain? Many of us have thought that way. That is AI for you. AI is that student that never gets tired. You read from morning till night, retains all the information and never forgets. That is AI. So you can see why putting the power of AI to work in medicine can make medicine do incredible things. So we're going to be starting this series on AI, talking about how it's used in medicine and how it is used in surgery. Of course, because there are so many advantages, there could also be a number of drawbacks to the use of AI. Now, I'll give a few examples of how AI is used. There's an investigation called the mammogram. And what is done is that it's just like, you all know what X-rays are, right? So you take a film showing the breast, and then you look out for some features in the breast that might point at an abnormality, even when the patient has no symptoms, right? So that is what the mammogram does. So we try to use it to detect cancers early in the breast. But you know what? What we do is you take those films and then the radiologist goes, looks at it, and decides that, oh, this is suspicious. Now, how do you put AI to use in that scenario? What you simply do is all the features of breast cancer in the mammogram, you feed them into the AI. So the AI can recognize all those features. So if you have loaded so many of those features, okay, the AI can recognize it by itself. So what happens? All you need to just do, the patients come, they take their x-rays, you just put it into the machine, it just tells you that feature is there, it just tells you that feature is there, that feature is not there. Very simple. And then you come up. So, and you know the advantage, a radiologist will say he's tired. I've looked at so many films today, I'm tired, I can't look at any films anymore. But you know what the AI 10,000 is not tired. Just keeps telling you that this one is abnormal, this one has this feature, this one has that feature. Alright, so makes work very easy. The key thing here, especially for mammograms, is that usually if there is no abnormality, the AI will not tell you that there's an abnormality, because what you have loaded inside it is the features of the abnormality. So those ones that are abnormal according to the AI, which we feel anyway, can now be rechecked by the radiologist. You can see that's the incredible thing about AI, the use of AI in radiology. AI is when AI is put to good use, there are many things that usually would be unachievable but can now be achieved. I'll give you an example in aeronautical engineering. Do you know that when planes are flying, many times the pilots would not be able to see another plane in the distance? By the time a pilot is seeing a plane in the distance, it might be too late and then there might be a plane crash. So what do? You simply put in the technology that will detect that there's a plane nearby. So once The thing detects the planes nearby. It starts to alert the pilot and say, "Oh, there's a plane nearby." So is the pilot more intelligent than the AI? No, but the pilot is the one that is going to be able to put it to good use. The last example when we talk about surgery is that AI makes difficult surgeries possible. The key thing about surgery is that you should be able to use your hands, right? So that means your hands must be able to enter the cavity. Now, our hands are quite big. Some people's hands are bigger than mine, some are smaller. So imagine that your hands cannot enter this cavity. It means that operating in tight spaces will be difficult. So what does AI do? Goes from the principle of laparoscopic surgery, which is pinhole surgery. So in pinhole surgery, what you do is that you make holes and you put in instrument through those spots. So those spots make it easy for you to control and makes it easy for you to operate in tight spaces. So what do you now do to make it robotic, which is where we are going when we are talking about artificial intelligence? You now connect the arms of the laparoscope to a robot. So instead of you manually moving the laparoscopic ports to try and do those things, the robot does all those motions. So all you are doing is moving with tiny, tiny motions as if you are playing a video game. You sit at the console and you are doing those things. And then it makes you able to operate in really tight spaces. So this series is going to be telling you about what the wonders of AI are and the disasters that can come with the use of AI, because there are actually very, very bad things that can happen when you use AI, especially when you are not trained enough to use it. Catch you in the next video. Bye.